Hello dear patients and our followers, I'm Dr. Ahmedov, a hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today I would like to share with you the experience and the outcomes of the patient who underwent the hair transplantation surgery in our clinic more than 22 months ago. This is the 42-year-old male with the neurotype 5V of the hair loss. The neurotype 5V of the hair loss mainly means the loss of the continuity of the front hairline, receding in the front right-left temples, loss of the volume or thinning in the front forelock and the front third. There is some thinning in the hair loss in the mid-scalp and the empty spot in the crown area. So basically all three anatomic areas, the front, mid, and the crown areas are affected by hair loss. As we've mentioned earlier, or in the cases we've shared with you before, for this type of patients, on average, we need the numbers varying between 4,500 up to 6,000 grafts. The numbers change from patient to patient depending on the size of the open area, the density you want to get, the expectations of the patient. So there are many variables you have to take into consideration. And the patient has been transplanted 4,500 grafts. That was a mega or even giga session at some point. Out of this number, 2,500 grafts were implanted in the front side, 800 grafts were implanted in the mid-scalp area to improve the density there, and 1,200 grafts were implanted in the crown area. So totally 4,500 grafts. And here you can see the results of the patient almost 1 year after the surgery. You can see that the front hairline is improved. There is a good coverage in the front side, front forelock, and front third. There is good improvement of density in the mid-scalp area, but there is pretty much of the thinning and hair loss as well. And there is a good coverage in the crown area. For the neurotype 5 of the hair loss and above, in some patients, even starting from neurotype 4, every once in a while, more than one surgery may be needed. The multiple step surgery is needed to acquire better coverage and the density, but as a general rule, we say it's most starting from neurotype 5. The patient, we were able to cover up to the 80 to 85% of all the open areas in the patient's hair loss pattern. So it's a good coverage for single surgery. Upon request, we have talked with the patient, decided that if he'll need or if he says that he wants slightly more coverage, especially in the crown area, the second surgery may be carried out so to get the much higher density, but it's a very individual approach. That's the question we get most of the time from the patient, asking, will I need single surgery or two surgeries? It's very individual. It depends on the level of the hair loss you have, neurotype 1, 2, 3, 4, 5, 6 or 7, whichever you have. But one of the key features are the donor area capacity. Will the donor area be able to give a sufficient number of the grafts to give a good coverage? And of course, we always try to get the good amount of the grafts per single surgery, but there are also limitations for this one, like safe donor zone criteria, the number of the grafts we can get from per centimeter square of the skin from the back of the head, and there are many different aspects. So it's a decision that is made individual from patient to patient, but as a general, we say that from neurotype 5 and above, most of the time to acquire good coverage and the density, more than one surgery may be needed. So the patient, as you can see from the pictures, has a good coverage. Most of his needs and expectations are covered. He's happy. We are happy. The main purpose of rebuilding the front hairline, having the front frame of the face rebuilt, because that's what most of the people will see most of the time. It's this front and the mid-scalp areas, and he has a good amount of the coverage. And of course, after the surgery, for most of our patients, we definitely advise the medical treatment. It can be finasteride, it can be minoxidil, or it can be a combination of both of them, because with the surgery, we try to cover the open areas as much as possible, but the medical treatment is always very important to prevent furthermore loss loss of your non-transplant or pre-existing hair. So it's like a puzzle. You have the hair loss fitted in, but if the active hair loss continues, you may end up with new empty spots in between them. So as I tell the patient, the best surgery is not having the surgery if you can avoid it with the medical treatment, and that should be one of the fundamental approaches in this type of hair loss. Thanks for watching us. Stay tuned. If you have any questions or codes, you can put them under this video and we'll be glad to answer them. Take care.